Hi dear dentist, I am Dr. Satish Bhalgat. Do you know that snoring is one of the symptoms of obstructive sleep apnea? And if ignored, can have gruesome effects on blood pressure, heart and brain. Also, headaches, fatigue and tiredness are common when your patient is unable to catch enough quality sleep. Why am I telling you this? Well, dentistry and sleep medicine are interlinked to each other. About 80% of such cases go undiagnosed. But as a dentist, we are in a unique position to not only screen such cases but also to manage them. How? Using ASD, a customized and effective oral anti-snoring device. Anti-snoring devices work silently amongst all the noise. It is categorized as an EMA or elastic mandibular advancement device that opens up the airway without disturbing the sleep. The presence of the connectors on either side allow for all the lateral movements as well. The connector at the sides will decide the degree of the mandibular advancement according to every patient's needs. The device activates the muscles and ligaments and stops the airway from collapsing at night. Additionally, it also prevents grinding of the teeth and even mouth breathers can easily adapt to it. The ASD has a significantly high compliance rate as compared to the CPAP machines or surgeries because it is absolutely odorless, tasteless and non-toxic. It is so comfortable, thin and lightweight that the patients forget they are wearing one. Every device is custom made, unlike the over-the-counter products. Following a thorough case history, you just have to scan the patient's impressions and send them to us. We will fabricate it and send it to you. With ASD, you can assure your patients a more peaceful and an uninterrupted sleep at night. Thank you.